Okay. What else you got?
All right, so Senate Bill 1315 is a bill you're going to love because it has to do with masks.
Oh my gosh. All right.
So we took care of our kids in public schools and eliminating the requirement to wear masks. And generally speaking, we don't wear masks in general. And I don't know if you all saw this or not because we've been so busy during session, but President Biden just declared on January 30th, that was yesterday, declared that COVID pandemic to be over. It's effective May 11th. That's the day that COVID is going to officially be over. And that's according to the New York Post, CNN. It's public knowledge. The pandemic is going to be over. So what can we do about masks? I think it's time to get rid of the mask. I actually, I presented all the 32 studies and everything talking about how masks actually make you sick during the last session. I've got a number of studies which I won't go through today, but I will tell you the University of Wisconsin is concerned about those fibers that are in your mask that actually get in your lungs. I've got a number, the University of Copenhagen agrees with that. They had over 6,000 participants that were involved in this, and they found issues with the microplastics that you inhale and actually end up depositing in your lungs and all the issues therein. So to cut to the chase, even if you look on a box of paper COVID-19 mask, what does it say by the manufacturer? It says does not protect against viral infections. So, Mr. Chairman, I would ask the body, the president has already said May 11th, where COVID is gone, we're going to be getting rid of masks. This is going to go to effect in July 1.
Right.
It's time to get rid of the mask.
Okay. Let me. And I was in the middle of the mask wars last year. And
Yes.
I was, and I don't regret a moment of it. It's one of my.
Let's do it for the adults,
Well,
too.
hold on. The children were different because of the way 1303 was structured. It was basically we gave them leeway, and then we had to take it back. And like I said, that's how it is. Localities right now don't have the ability to enforce a mask mandate. Okay, some of them asked for it. We didn't give it to them. Here's where I stand personally. I don't want to deal with masks this year. Okay, I look at this bill, and I'm the same way. I don't think it's right for government to require anyone to wear a mask or a private employer. But at this point, I just don't want to deal with this fight again. Okay, I spent a year fighting this. I'm over with it. So I appreciate, again, you're bringing this bill up. We had so much testimony on this over the last 2 years. I don't need any more testimony. I've heard it all. So I don't know if there's a lay the bill on the table motion, but I just feel like at this point, I'd just like to give this issue a rest for a year. And I'm not wearing a mask, okay, and neither are you.
Me either. I haven't.
It's
too
not
strong.
a clear and present danger to us right now. No.
Mr. Chairman, if I may, my issue is I just don't like the government telling businesses and private industry what they have to do. And you're talking about private schools who we do not govern and private businesses that we do not govern. Let them make people not want to go in there because they're wearing masks. But if we let the state start getting in our business, we are on a treacherous, slippery slope, and that's why I cannot support this bill.
All right.
Mr. Chairman,
Yes, Senator Suderline.
so I think this is probably the subcommittee and probably the entire General Assembly, even compared to the other body, its current composition was the most opposed to mask mandates in
No doubt.
public schools.
Yeah, I doubt that.
Between just from the chairman to this end of the table. Well, and that he just saw it differently, and that's quite all right. That's what we're here to do, is discuss our different views and what can be best for the Commonwealth. But this bill, which is shorter than the other one, but it seeks to do so many different things. Last year we were directly dealing with public education in the Commonwealth. This has a section dealing with private schools, which Senator Donovan alluded to. Parental choice, the parents have chosen to send their child to the private school. If the private school chooses to have that policy, the parent can decide to say, well, you were there Friday, you're not going back Monday. I just don't see why we dictate to the private school that. I mean, my kids go to public school in general, and but if I were choosing to send them to a private school, I should be allowed to send them to the private school of my choosing on that. And also this provision that says employers can't do it. So does that mean that the hospitals couldn't do it?
That was another issue, that you might have healthcare providers.
Mr. Chairman, just finally,
Yeah.
I think it's just a difference in philosophy of who believes the mask and the vaccines are effective and who believes they're not.
No,
You
just
know,
if I could
I mean-
continue real quick on that point. Long before I'd ever heard of COVID-19 or coronavirus or anything like that, when each of my children was born, I was asked to wear a mask there, and I didn't like it, but I said, that's all right. I understand that I'm in your hospital, and I want to be present when this happens, and my wife really wants me to be there, so that's the way it's going to be. I just don't think, I think the way this bill is written, hospitals couldn't even tell surgeons that they have to wear the mask, and I think that they should wear masks. And I think the hospitals ought to be able to say that.
All right, guys, I don't want to beat this into the
Second.
ground, but we have got to get this moving. All right, I have a motion, PB, I have a second. All in favor, say aye.
Aye.
Okay. Any opposed? No. All right,
Thank you.
Amanda, thank you. All right.